Now for up next, we are looking at the components of urodynamic studies. So if you want to perform urodynamic studies on the patient, what are the things you are supposed to do? And of course, what are the things that you don't want to miss out, okay, in the urodynamic studies? So for urodynamic studies, if I'm asked to describe or define terminologies, right, I'll say uro is anything urinary system. Dynamic is something that can be moved or something, So there are a group of diagnostic studies. They evaluate how well, okay, they evaluate how well the bladder, the urethra, and pelvic floor muscles are able to store and also release urine, okay. So these tests are very important in diagnosing issues that are related to bladder issues, okay. So key components of urodynamic studies, that's things you do in urodynamic studies that you shouldn't miss out. You have things like what? Uroflowmetry, okay. That one, you are trying to dictate the rate and pattern of how urine is flowing. It dictates if there is obstruction or if there's a weak detrusor muscle or incomplete emptying, Then post-void residual volume, trying to access the amount of urine that is left. That's after somebody urinates, if there's some urine left, okay. So cystometry, you're trying to evaluate bladder pressure and volume during filling, okay. Pressure flow study performed during voiding phase, okay, measures detrusor pressure and flow rate simultaneously. So it helps to differentiate between if there's obstruction or probably there was just a weakness in bladder muscle. Urethral pressure profile, access urethral closure pressure along the length of the urethra. Electromyography records electrical activity of the pelvic floor muscles and the external and dictate neuromuscular dysfunction or incoordination. Then video urodynamics, that one is just real-time imagings, real-time imagings of the structures. So you're trying to visualize how the bladder is being shaped, the reflux, and if there's any anatomical abnormalities.
Good morning, sir.
Alright.
Very well, sir.
So that's what we have for urodynamic studies. These are things that you shouldn't miss out, okay.